Yeah. Nothing like a kid's football game to wear you out. But was it hot out today or what? Yeah. No, I gotta get these cupcakes in, okay? Oh.
That noise you just heard? That was the sound of a heart attack. It happened over 1 million times last year, and in most cases, it could have been avoided. Most heart attacks are usually caused by tiny blockages in places that no one suspects. Worse yet, stents, angioplasty, and drugs are not always the best treatment for stable patients, and over half of all patients suffer cognitive problems afterwards: confusion, memory loss, and sometimes even stroke. There's a new non-surgical alternative that can cut your risk of heart attack by up to 80%. It's called external counterpulsation, often referred to as compression therapy. Compression therapy is really the new medical bypass. It's painless, non-invasive, and much less costly than surgery, and it really works.
11 News at 5.
Houston area patients who suffer from angina have a new treatment to discuss with their doctors. It doesn't require surgery, but it looks strange. Those who've had it, though, say it works. In today's Focus on Health, Dr. Karen Johnson tells us what she's discovered.
Bill Brindley is 64 and had a massive heart attack a year ago.
Believe me, I thought I was going to die. I really did.
For an hour a day for the last 7 weeks, he's come to cardiologist Dr. Peter Chang's office for ECP, or external counterpulsation. It forces the blood in Bill's heart to bypass blockages and decrease the symptom of chest pain.
Previously, the only option you can offer then is just medication. Medication just controls the symptoms. It does not reverse or repair the blockage.
For angina sufferers or people with chest pain, it may be a preferred alternative to bypass surgery, angioplasty, or medications.
Most of us believe that the main benefit is this treatment allows the heart to develop what we call collaterals, or tiny little blood vessels that's going into that area that's lacking oxygen.
Dr. Chang cautions that ECP is not the first line of treatment if you have blockages in the heart, especially if you have unstable angina or chest pain. Studies show that 80% of angina sufferers benefit from ECP treatment. The patients have reduced symptoms, less chest pain, greater stamina, and they require less medications.
This is actually the nature's way of repairing itself.
At 64, Bill says he's never felt so energetic.
My energy level is probably twice what it was.
With today's Focus on Health, I'm Dr. Karen Johnson.
This is Larry King with some information you need to know. Perhaps you've had an angioplasty to clear a clogged blood vessel. I've had 2. Or maybe you've had bypass surgery. Mine was a quintuple. And I don't mind telling you, it scared me into some major lifestyle changes and moved me to help others with heart problems. But if you're no longer a candidate for these life-saving procedures, your current therapy isn't succeeding, and you suffer from angina with daily activity or while resting, you and your cardiologist should know about another treatment option that could significantly improve your heart health. What is it? Well, let's ask the experts.
EECP is a non-invasive therapy designed to help those with heart disease, specifically clogged heart arteries, who suffer from angina.
Cuffs that are separated from each other are placed around the calves, the thighs, and the hip area, and each set of cuffs is inflated in a very prescribed sequence. The result of this sequential squeezing and holding of the various segments allows the blood from the lower extremities to be propelled forward in the body towards the heart and augment the blood pressure that perfuses the heart muscle at a time when the heart is relaxed.
Usually after about the second week or third week, you begin to notice decreased episodes of angina, improved exercise tolerance. And most people see the full benefit of this therapy after the 35 treatments.
Before the treatment, trying to take the dog for a walk was a hassle really for me. When Pat Byrne first walked into my office, she was complaining of chest pains and shortness of breath.
And it reached a point where I couldn't even go a block with her. We had to come back.
I referred her for an angiogram, and that showed a severely blocked coronary artery in the bottom part of her heart.
I always prided myself in being in great shape and being able to do anything I wanted to do, and I wasn't doing that.
Bob had a blockage pattern that involved a major artery and a major side branch of that artery, and it made it extremely difficult from a technical point of view to actually perform an angioplasty that had a high likelihood of success.
Even though I had the angioplasty, I was still having such chest pains when I would attempt to exercise that I'd stop after a short period of time.
What was the EECP treatment like?
In the beginning, I didn't know what to expect when I walked in there, and I thought, oh gosh, what am I in for? But after I was put on the bed, hey, it was fine.
The initial feeling of when they inflate the cuffs has the body move up a bit from the bed and down, but it's not a frightening sensation.
The basic treatment itself I found actually very fulfilling. I mean, after I got finished with a day's worth of the treatment, I just felt good.
How well does EECP work?
Over the 3 years, I've really treated a lot of patients, and it's very impressive how well they do.
My energy level is generally quite high.
I'm back to walking 3 miles a day and doing the yard work and painting.
Well, I'm exercising on the average of 5 days a week. And when I'm not exercising per se, I'm pursuing some sort of activity like skiing or hunting or fishing.
I have personally been involved with 600 patients that have received EECP therapy, and fortunately it's turned out to be a very safe and effective treatment for those patients.
When we evaluate all of our statistics, we're finding that between 75 to 80% of patients will respond to an initial 35-hour course of treatment.
How safe is EECP?
EECP has been shown to be very safe.
How effective is it?
Fortunately, there is a lot of data to support and substantiate the effectiveness of EECP.
It was amazing because after the treatment, the angina disappeared. I was able to live the type of lifestyle that I really wanted to live.
The oldest person I treated was 97 years old, and she's turning 100 this year. This lady was in hospice, crippled with chest pain. She couldn't get out of bed without having severe squeezing pain in her chest. She was on morphine. And now, after these treatments, she's actually traveling around. She completed a cardiac rehab course. It was just amazing.
I enjoy outdoors. I enjoy physical exercise. I was able to resume activities that I always wanted to do without being interrupted with the pain.
You come for ECP treatments 1 hour a day, 5 days a week, for 7 weeks.
Does insurance typically cover EECP?
My insurance carrier totally paid for everything.
Medicare takes care of the payments, thank goodness.
I've treated patients starting 3 years ago, and several patients have had no other treatment, and they continue to improve.
So when you talk to your doctor or your cardiologist and you have symptoms that are related to clogged heart arteries, then this may be a very effective treatment for you.
There you have it. Enhanced external counterpulsation, EECP. Non-invasive, safe, effective, affordable, and in most cases you're covered. Finally, these thoughts. Your heart is more than just a vital organ. Since time immemorial, the heart has been known as the seat of the soul, the home of the spirit, the source of courage and compassion, hope and love. EECP is one of many ways you can take better care of this precious part of you. So do something now to safeguard and improve your health. Talk to your doctor about your cardiac condition. Get all the information, make an informed decision, and then take action. Take it from me, you can't go wrong if you use your head and listen to your heart.
Yeah, nothing like a kid's football game to get you worn out, huh? Was it hot out or what? Yeah. Okay, listen, I gotta get these cupcakes in, all right? Okay. What a nice day.
So please, before saying yes to surgery, You owe it to yourself and your family to call Adkins Medical Group, 317-887-7067, and check out the facts about this non-surgical procedure that could save your life.